Good morning, everybody.
Morning.
I'm just letting a few of you filter into the waiting room.
Can they hear me say good morning?
Yes, you
Okay,
should be
good.
able to
Oh.
hear Caroline and myself. Just waiting for everyone to filter through. Right, I'm going to get going this morning. Welcome, everybody. Good morning. Uh, good morning, everyone. Welcome to B&M Care's Dementia Awareness webinar this morning. My name is Angela Hunt, and I'm the Sales and Marketing Director for B&M Care Homes. And with me today to present this webinar for you is our Director of Dementia Care, Caroline Inch.
Good morning.
A very warm welcome to our existing families joining the webinar today, and also welcome to those of you out there who've been struggling with a recent diagnosis of dementia for a loved one and trying to find your way through accessing further information and support. B&M Care have been operating care homes for 50 years now, and with 28 care homes in our portfolio, a new site under development in Milton Keynes, we've got a lot of knowledge and experience of caring for older people, and especially supporting people who live with dementia. We kind of take the view that providers like us have got a real responsibility to share our knowledge with our families as well as the wider community. So today's webinar is part of a series of discovery events that we deliver, which includes the Funding Long-Term Care webinar, the Virtual Dementia Tour, and our new Level 1 Dementia Awareness accredited training. You can visit our website, bmcare.co.uk/events for any upcoming dates. So let's move on to today's event. You will see that we've got your cameras turned off and your audio muted. So if you have a question as we go along, you're welcome to add it to the chat and we will do our best to cover these off as we go. If we don't reach your questions, then we'll be happy to respond to you on email after the webinar. We're recording the webinar today, so a copy can be sent to you within the next couple of days. So moving on to our host for today, Caroline's worked in the sector for 28 years, starting her career in care homes, progressing to care home management, and then into senior operational and dementia leadership roles. Caroline's got a first class honours degree in dementia studies from the renowned Bradford University, and she now steers B&M Care's vision and innovation around the delivery of person-centred dementia care. As you will soon see, she's very passionate about research, evidence-based dementia care, and ensuring that all of our residents experience the very best well-being whilst they're in our care. Okay, so I'm going to hand you over now to Caroline, who's going to take you through today's Dementia Awareness webinar. Over to you, Caroline.
Lovely. Thanks, Angela. Good morning, everyone. So thank you for joining today. We want you to go away having learnt or helped you in some way around dementia. So we have pulled together a number of objectives. Our little our little webinar today is CPD accredited. So if you are a professional here, because we don't know who's actually joined here today, you can pop your email in the chat and we can get a certificate out to you, because it's always good to have your CPD for your evidence as well. So what we want you to learn today is to interpret behaviours of distress. And we sometimes do see this in people living with dementia. In addition to that, we hope that you understand a little bit about the term person-centred care and how you can apply this at home to support your loved one. Also, how care homes in your community can positively support, because, there's lots of care homes everywhere and we do have an element of responsibility to support our general public. So this is hopefully will be covered off in today's webinar. So first and foremost, I always find it quite useful to give you a bit of a brief overview on the most up-to-date dementia care data. Currently in the United Kingdom, we have 950,000 people living with dementia. 1 in 11 people over the age of 65 have dementia. And there's around 20,000 people with young onset dementia. And this means that they're under the age of 65. Now, you may have heard of the term early onset. That refers to age, not the stage of dementia. So if somebody says they've got early onset dementia, it should apply to somebody who's under 65 years old. Now, dementia was and is a bit of a ticking time bomb. The Prime Minister back in 2015, which was David Cameron, said that by 2020, we would be the top country in the world for dementia care and research. Now, he did do an awful lot of work, but I suppose with COVID and other things, taking precedence in the public, there is a delay or a lack of research around dementia care, but not from Alzheimer's and the National Dementia Association, for example. But there is a lot of work that still needs to be done. The last National Dementia Strategy, Living Well with Dementia, was published in 2009. And, that's some 15 years ago. So there's a lot of work that needs to be done, which is why it's important for care providers and other institutes to support and guide around dementia care. So dementia is a condition that affects the brain. And dementia is an umbrella term to describe a number of symptoms, and they include issues with memory, communication, language, executive functioning. There's over 100 different types of dementia, but we in our care homes most commonly are used to caring for people with Alzheimer's, vascular, Lewy body, and frontal lobe. Now, these are the most common forms of dementia. Getting older and having dementia or memory relapses is getting older and having memory relapses is very different to getting dementia. Losing your keys is a normal part of aging. We all do that. But holding your keys in your hand and wondering what to do with them is not normal. We also find with old age that language, finding the right words, is modestly affected by the aging process. And the speed of processing information does gradually slow. But again, this is normal, and it usually starts from in our mid-40s. Forgetting words and having them on the tip of the tongue, or walking into a room and thinking, what am I doing here, is normal. Also, there are lots of things that impact our memory, such as stress, poor diet, lack of exercise, deficiencies such as vitamin D, B, and iron, and also menopause can all impact our memories. What we also use in dementia care is a term called executive functioning. And this is a process of information that we use in order to plan and make decisions and problem solve. And what we find with dementia is that people may have difficulty with their executive functioning. And we often observe this when we have residents getting stuck on different things, like maybe washing or dressing, might have one leg in a trousers and might be sitting on the edge of a bed thinking, what do I do with this? Another example of impaired executive functioning dementia includes poor judgment, disorganization, and disinhibition, or inappropriate behavior, for example. And we may sometimes see that, with your loved ones at home. And we often see this within our residents, within our care homes. We often also hear about stories of residents being found wandering the streets at night time, maybe in their bedclothes or not wearing suitable clothing, maybe going out in the rain or in bad weather with just their gym jams on or something. So this is around your executive functioning. So dementia does impact in very many different ways. It's not just with memory loss. So as I spoke about earlier on, there are reversible conditions that present like dementia. So risk factors of developing dementia are age, lifestyle, and genetics. And there are also lots of things that we can do to prevent dementia, such as keeping a good weight, eating a healthy diet, reducing stress. Because if you think if you're stressed out, it elevates your cortisol and your inflammation, and that brings about dis-ease. So keeping an eye on things like blood pressure and cholesterol and taking regular exercise is really, really important. Now, a 2022 study in America found that low blood levels of vitamin D were also linked with a higher risk of dementia. And we can boost our vitamin D levels from diets and supplements. Unfortunately, in the UK, we don't get enough sunshine, and we could all do with a little bit more of that. But so definitely, if you are presenting, memory loss, it could be, just something simple like a deficiency. There are also things like low iron, UTIs, urine infections, and feeling poorly can all impact memory and cognitive functioning, but they are all treatable as well. So in this section, we take a little look at the brain and how dementia affects the different parts of the brain. And I always find this very, very useful to share, particularly in our training session, because it gives a little bit of insight into how a person with dementia may present and why. In person-centered care, I don't know if you've heard of that term before, we don't place a lot of emphasis on the clinical element of the disease. We place it more on the person and their psychological and their social well-being. But we do need to know the biological element and how dementia affects the brain. So the brain has four lobes of the cortex, and they all do things very, very differently, and dementia affects them differently. For example, the frontal lobe, which is at the behind the eyes, controls our emotions. It controls what we say and what we do. It also supports planning and executive functioning, which we spoke about earlier on. Now, the temporal lobe, which is at the side of the ears, this part of the brain is all about knowledge, understanding, memory, and language, and communication. It also controls inhibition and mood. So, if you have damage to that part of the brain due to dementia, it can increase mood swings and disinhibition, which is where we could also see an increase in sexualized behaviors. The parietal lobe, which is up there, the top of the head. If that's damaged, it can affect the process of planning. It also increases poor spatial awareness and bodily awareness and dexterity and motor skills. So that can affect somebody's mobility. It can increase the risk of falls. It can also impact their nutrition because they can't use a knife and fork properly. So, it is really important for us to understand, what part of the brain is damaged and what type of dementia people have. What we also see if people have the parietal lobe damage is that they tend to wobble a lot and they may bump into things. So it puts them in a higher risk of bruising and falling as well. And then here we have the occipital lobe, which is all about visual perceptions. The occipital lobe helps us make sense of what's coming through our eyes. And if there's damage to that part of the brain, that will impact the way in which a person with dementia sees their world. And then this could also impact how they interpret colours, lines, shapes, and patterns, which can then bring about an hallucination. In addition to that, if they are having these hallucinations, they're going to get anxious and frightened, and it brings about a behaviour of distress. So it is really important that we share this with you because it's also very important to get a diagnosis to find out what type of dementia your loved one has or anyone has, and what part of the brain is affected. So in this slide, we look at notable behaviours and how they may present in dementia. And this is thinking about, what we spoke about, the social and psychological elements of person-centred care. A loved one with dementia may exhibit a challenge in behaviour, and we refer to these as behaviours of distress. We don't like to use the word challenging because people with dementia shouldn't be deemed as challenging. And we always look at these behaviours of distress as a form of communication or an unmet need. People living with dementia may exhibit these behaviours because they're trying to tell you something that they just can't communicate. And they do it by expressing their feelings and their fears in an outwardly way. Most behaviours of distress may appear to be challenging, and there are different ways that we can visualize them, we can see them, and there's different reasons for why they present like that. When a person with dementia feels disempowered or they're losing control, they will try to take control back. They will try to have autonomy over their lives. They may be new to a care home and they may show behaviours such as hoarding or refusing to bathe or wash. This is so they can retain a sense of control and autonomy. To help them feel in control, give them a sense of dignity and self-worth, telling you no, I don't want a bath. No, they're my newspapers. We see an awful lot in our care homes where we're always forever missing dentures and hearing aids where they've wrapped up and put in lots of little tissues and popped away in drawers. So this is just about having control. In addition to that, we also see a lot of a lack of focus, so not being able to sit still, walking around quite a lot. And we like to use that term walking with purpose. We might have heard terms like pacing and wandering, and these are all seen as behaviours of distress. There are reasons for that. There are reasons for people not being able to sit still, and it could be undetected pain and discomfort. Are they hungry? Are they thirsty? Do their shoes hurt them? You know, we always have to rule in and rule out pain if we do see a behaviour of distress. In addition to that, we spoke about the loss of peripheral vision. And if we don't communicate face on, we end up with a high startle response, which could lead to a person hitting out and then get labelled aggressive or angry. We've brought about that behaviour through our own actions, through the way in which we communicate. So we always communicate face on, at eye level, and very, very short sentences, nothing too long, because it can be far too much information for a person living with dementia. Difficulty recognizing people, again, that must be, you know, so awful, not just for the person living with dementia, but also for the loved ones and the caregivers and the daughters and the wives and the husbands who, you know, who are not recognized anymore. And we call this facial agnosia, and this is often reported quite a lot in Alzheimer's, and it is often attributed to the memory impairment. Now, what we do is we had a situation in one of our homes where a relative was very upset. They were visiting their mum, and the mum kept referring to the son as her husband, and then that made her upset when the son was like, "No, I'm not dad, I'm Mike," for example. So what we encouraged him to do, supported him, was to go with it, to jump in that bubble. That's a cliche term, but you'll hear that an awful lot in our sector. And it really does work, because you're validating that person. You're not saying, "No, I'm not your husband, I'm your son." But the lady didn't see that. She only saw her husband. So he would sit there and he just wouldn't challenge that perception, and he went along with that. And his visits with his mum were much more pleasant and manageable for them. So it's really important just to look at that. In addition to that, we've got an increased risk in shadowing, and that's where somebody with dementia is following a person around. And this is largely to do with your loved ones feeling scared or vulnerable. So they might follow you around the house, or they might, you know, if we're in care home settings, they might follow us around the care home. So again, it's just lots of love, tender loving care and reassurance, and just letting them know that you are, you know, you're a safe person for them. So in addition to what we've spoken about, there are other reasons why we do see behaviours of distress. And I touched on it a minute ago. Pain and discomfort that's undetected is a big cause for changes in behaviours. Pain is one of the most common symptoms that people with dementia experience. How often it's very poorly recognised and undertreated in dementia. The main reason for this is, as your dementia progresses, your loved one's ability to communicate pain becomes more difficult, which is why we do need to treat pain appropriately and recognise the different signs of pain. We've been doing some work with an organisation called Pain Check of late, and we have it in at 5 of our homes, currently working through all of our homes. And it's an app that can detect 9 facial muscles that are not visible with the naked eye, that are indicative of pain and discomfort. And it's a very powerful tool, and I think they are looking to use it in paediatrics as well, because babies can't verbalise pain without crying as well. So if a family is presenting a behaviour of distress, I would always first and foremost think, are they in pain? Other poor health issues can also contribute to behaviour of distress and dementia, and this could be as a result of an infection, such as a urine infection. And if your loved one has a sudden unexplained change in their behaviour and an increase in confusion, agitation, or apathy, this could be because of a UTI or a chest infection. And we also have things like sore gums, gum ulcers, you know, sore toes, all the little things that we don't really think about. Low mood and depression are other reasons as well as having the negative feelings. If a person with dementia has depression, it can make problems with their thinking and memory so much worse. Dementia may also make any changes in their behaviour worse as well. And you may see a lot of like agitation or aggression or shouting out. The person may have dementia due to their diagnosis, or but it it could also be to do with loss of control around their lives, trying to retain a sense of who they are. Then we have the side effects of medication, and medication like antipsychotic drugs, which can cause very serious side effects, to include things like daytime sleeping, drowsiness, confusion, shaking, reduced mobility. Now, what we do is we have a lot of very strict protocols and policies around this, and we always work within the NICE guidelines. But again, if your loved ones at home and they are presenting these type of problems, I wouldn't just reach for the medication. Try and rule out all these different elements, such as the pain and the infection, before going down the medication route. If you're having care at home, one of the most powerful things a caregiver can do is to shape care plans and our care around the lives of the people we care for. So life history work is really, really important, because it can help people with dementia share their stories, and again, you're enhancing their sense of identity. And this is especially useful when having difficulty with sharing information about themselves. So life story work is a tool that we would use, and we would encourage families to use that as well. So if you are at home, it's important to share life work, life history with your care provider. So, what we've been able to do is understand a little bit about people's personalities, what's made them tick. If we've got a resident who is constantly maybe walking or pacing around an environment, yet they've been a habitual walker, their past is going to come into their present day. And then we're able then to tailor their care plans around that. And it shouldn't be any different for care at home. Sometimes we hear, I've been in the sector a long, long time, and you talk to people, working domiciliary care, that, turn up at 7 o'clock to get Fred up. But Fred's life has always been, he's got up at 10 o'clock and he's had the Daily Mail in bed. So they should still be able to do what they've been used to doing. And you'll find that it's very much more better to care for people that way, if we can align our care with their life history. One thing that we've also focused on is the environment. And there's a lot to say about having an over and under stimulating environment. And that really does affect a person living with dementia, as they can be extremely sensitive to their environment. In general, a moderate level of television or radio is the best, because if we have overstimulation, we see an increase in confusion, agitation, whereas too little stimulation also causes people with dementia to withdraw from the world around them. And we can sometimes see that if things are too quiet and they're dozing off in their chair. There's a lot of research around daytime sleeping as well, and an increase in falls. So having the right environment, and not too much and not too little going on. In addition to that, there are lots of different things we can do to support our loved one living with dementia. And we have a few, I suppose, pieces of advice to share with you. We often say, don't confront and correct the person with dementia. And we use a technique called validation technique. So a resident might say, I want my mum. You can't say to them, oh no, your mum's not here, or your mum died 10 years ago, or your mum died 30 years ago. You've got to kind of turn the conversation around and be like, your mum, yes. Did you both have, that lovely dark brown hair that you've got? Or did your mum have the same eyes as you? So that way you're still talking about mum, you're validating about mum, but you're steering them away from the negative responses and the negative connotations around why they want their mum. So go with their reality, climb in their bubble, and what's real to them is really real to them. I've been very fortunate to have met a wonderful guy called Norman McNamara, and I don't know if anyone has heard of him before, but he pioneered the Purple Angel charity, and he does a lot of work all over the country. And I was on a Zoom with him once. He was telling me about an experience that he had coming back from Bolton. So lives now in Devon, but he was doing a talk up in Lancashire, where he comes from. And he was driving back with his lovely wife, and he got to this motorway in Devon. I don't want to give too much away on that time, so I'll highlight where he lived, but he got to this motorway in Devon, and he said it was like a screen coming down in front of his eyes. His whole world within a split second changed, and he was back in Bolton. And he turned to his wife and said, you know, why are we back in Bolton? She's like, we're not, we're back home, we're in Devon, look. And within another split second, he was back to his normal reality. Now, what's really powerful is that he can talk about that and he can share that experience, but also we use it now in our training, because if that's what the brain can do and people are living in their reality, their world is so real to them. Like we just don't know enough about it. So we do say, you know, jump in their bubble. If there's children running around the room, you need to go and deal with the children. If there's rats in the wardrobe, go and get the rats out, because it is really, really real to them. One thing that we tend to do is we focus an awful lot on the person with dementia. And what we've come to realize over the last year is actually we need to also focus on families, because, you know, you guys are the ones that are there caring and carrying, you know, this journey with your loved one day in, day out. And we need to also understand the journey from the family's perspective. So this is why, again, we're doing these webinars for you. And we've also got other little, you know, projects around dementia care going off in our care homes. It's so easy, but you do need to, you know, to say, but you do need to take time for yourself and, you know, have time out. What we say to our families at Dalton Lodge, which is one of my homes that I'm currently based in, is, you know, just come and have a coffee, you know, have some time, you know, even if you want to drop your loved one off in the care home for the day, just to, you know, go and take some time out for yourself. It is so important, because you're the ones, you know, that are doing this as a full-time job, but you're also carrying the emotional stress as well. And it's very important that you look after yourself. The care home, we've said this before, not just B&M, all care homes, all care providers. There's 5,000 across the group, across the company, of care homes for older people. And we are in the hubs of the community. So we feel that providers should be opening their doors and supporting people. We've got lots of dementia cafes and lots of seminars as well. So good platforms for you to, you know, obtain information, but also just offload and meet like-minded people. What we find for people with dementia is it's really good to establish very, very good routines. Familiar routines provide comfort and structure, and that will always ease anxiety. We see lots of issues, or we hear about lots of things about bedtime problems, you know, wake, sleep, night, circadian rhythm, all mixed up. So it's always good, I suppose, like with children, with my own child, you know, have a, you know, a consistent time for your meals, for activities, and for bedtime, and get into good routines and good habits. What we also talk about is incorporating lots of familiar activities. If it was, you know, your husband's or your dad's job to do the dishwasher and the bins, just still encourage them to do that. Even if it's like simple gardening or chores, it gives people a sense of purpose, and it resonates with their past and who they were. And it also, you know, supports their psychological needs as well. Avoid, you know, sudden changes, such as, you know, things that are out of the ordinary, you know, new appointments, you know, doing something totally different that isn't part of their routine, because that can also increase confusion and anxiety. We spoke about communication earlier on, and that is one of the most fundamental things we could do as carers, and it is about communicating clearly and slowly and not to overload. And communication become challenging, as we've learned, so we've got to keep it very, very simple with very short sentences. And we use Egan's Solar theory, which is where we communicate face on and with this squarely, you know, looking at somebody and just making sure we speak calmly and slow, because otherwise it can just be too much for somebody living with dementia. There are lots of things we can do in our own lives and our own homes around the use of colour coordination. So as we age, we lose the ability to differentiate colour due to the aging eye. So if you have that and then you have dementia, we have an even bigger problem. So we found it very, very useful to have either red or yellow plates, cups and crockery and placemats, and they can support with eating and drinking because they can recognise and see the contrast of the food. Also as well, just being at home, we've had things like grab rails to support independence. If they can't see the light switch, if you put something there's a contrast of colour around the light switch, they're able to then see that more easily. We often hear about things like black mats and shapes and patterns that can distort people's vision. So if you've got a black mat at home, it could be perceived as a hole. And if you've got a mirror, that could then confuse somebody and startle a loved one if they don't recognise themselves. We spoke about TV and radio on, so again, not on at the same time, and also got to think about sensory overload. We've often had questions about how do you manage or treat people that have a lack of appetite or are refusing to eat or drink. So what we often do is have small portions over the course of the day, and we call it grazing food. And that is food that can be picked up on the go. We also use fortified shakes, smoothies, lollies, for example, that are made, with lots of goodies like smoothies are just full of nutrients. So these are a few little things you can do to support, and they can go a long way in helping, somebody live with dementia.
Caroline, we have a question from one
Okay.
of the attendees. Is if vascular dementia has been diagnosed as affecting one part of the brain, does it normally impact other parts of the brain over time too?
No, not unless they have a number of other strokes.
Yeah.
So what we find with vascular dementia, it's a stepwise progression. So if they've had an episode, so I'm presuming they've had a stroke or a number of TIAs, it affects the frontal lobe. That's where the dementia will be. What we find with vascular, people could be absolutely fine, and then they will have another little stroke or a blip, and then they'll go down, and then they'll be fine again, and then we'll have a TIA, for example, and then they'll go down. So it's a bit of a stepwise progression with vascular dementia. So it just depends on the part of the
Hmm.
brain.
Okay, thank you.
Thank you. So how do B&M care for people with dementia? So in 2018, we developed our own model of care, which is really underpinned by the person-centred model. I don't know if people have heard of person-centred care and Professor Tom Kitwood at Bradford University. So we took his theory, because that theory is embedded in all policy across the country for people living with dementia, and we've developed our own B&M Rose model. And what we feel is that if you meet every element, and you could do this at home, you respect people's individuality, you empower people to live fulfilling lives, you engage and occupy people, and you're kind and compassionate, people will flourish and people will live well with dementia. And it really is, meeting, those psychological and social needs. I've seen an increase in people's mood just by being with their family. And I've also seen people deteriorate so much more quicker, specifically younger people with dementia in our care homes, where they've not had that emotional support from relatives. So families, community engagement is so important as well. In addition to that, we also measure wellbeing engagement, and we use an observational tool called dementia mapping. And again, that was founded by the late Professor Tom Kitwood. And we do this to observe the quality of our wellbeing and care in our homes. And it's really important as well, if you're receiving care at home, that your domiciliary companies, they will have audits and inspections and so forth. So you just got to make sure that the care that you're getting is really tailored to the individual. So I'm going to hand you over to my colleague now, Angela. But if you do have any questions, do let me know, and Angela will fire them over to me.
We've got a
Thank
few
you.
questions on the screen, actually, Caroline. So the last question here is from Carleen. How can we manage a person with dementia with mood, even if previous history at activity and new intervention try as well?
How
Quite
do we
understand.
manage mood?
Yeah,
It
mood.
really does. Yeah, it does depend. I mean, is there a pattern when you're seeing the mood? Is it later on in the afternoon? Because what we also see is an increase in low mood and agitation post 2 o'clock, 2 p.m., and we call that sundowning. So what we try to do to mitigate, this happening is we do lots of activities and occupation. But you just said activities doesn't really
Yeah.
work. I mean,
Okay.
I'd probably like to explore that with you more
Yeah,
in more
perhaps
detail. We
we
do
could.
do that because
Yeah, perhaps we can do that on an email afterwards, Carleen, if that's okay.
yeah,
We'll try and address any other
so I can
questions as we
yeah,
after. Perhaps we can give you our contact details at the end, and we can share that with you.
because it
So
could be life history,
it
it
could
could be
be.
work, could be
It
pain,
could even be
suffering,
environment,
depression.
couldn't it, that
Yeah.
is affecting that low mood and lack of stimulation. So just going back on to how providers and your local care homes can support. Um, Within our communities, we've got 28 care homes, but each of you will live in a community where there is probably a care home not very far away. So look out for the things that they're doing. Don't be afraid to phone them. Don't be afraid to reach out to them for signposting and support. Certainly, we would make time to be available to you if you contacted one of our homes. So we run things like memory cafes. A lot of other providers run memory cafes too. Look at your local care home as a place to come to for advice and support. You can use us for recuperation, respite stays, re-enablement, holiday breaks. Group and family support at community coffee mornings and memory cafes is a regular thing to look out for. It's an opportunity for networking with others, of course, isn't it? For people that are in the same situation as you. So if there's open days or events, then take part in them. Signposting as well. We're happy to do that. We also run a series of other discovery events, which I spoke about in my introduction. We run a funding long-term care webinar. We run a virtual dementia tour, and this year we have offered out our dementia awareness training, which is a training we deliver to all of our staff. But the virtual dementia tours probably would pique your interest the most, having attended today's event. The virtual dementia tour, although it says virtual, is actually in person. It gives you a very strange but unprecedented insight into understanding what it might be like to live with dementia. It is an interactive experience. It takes about 2.5 hours in terms of the whole training experience, but you spend about 15 minutes with it in a virtual experience. And we stimulate what it might be like to have your senses altered, so your sight, your touch, your hearing, and it really is a very impactful insight into what it might be like to live with dementia. And we make that training available to our relatives and to the public. The tour dates coming up this year, we've got 3 more dates. So you can reach out to our website where you found the details of today's event, but they are the next events coming up. We've got 27th of June at Dalton Lodge, which is in Walthamstow, 12th of September in Baldock, and the 28th of November in Boreham Wood. Okay, next slide, please, Chris Whitty. The other event I spoke to you about was our dementia awareness training. That again is in person. It's 2.5 hours. It is CPD accredited by Advantage Training. It's delivered to all of our staff in all of our homes. It's a mandatory piece of training. It's delivered by B&M Care's Head of Training, Elaine Thorpe. It's free. And it again sits as part of our sharing our knowledge with wider community. The next date for that, we only run 2 of those sessions a year. April's just been, so our next session is on October the 17th. Again, you can follow those links to sign up for that event. So really, just to summarize today, you can see it's our passion. You can see how passionate Caroline is about dementia care. We're very good at delivering good dementia care. So come and spend some time with us, or spend time at one of our community events, or indeed any of your other local care homes in the communities you're living in. You can sign up for the virtual dementia tour. You can sign up to dementia awareness. We will email you, if that's okay, a little evaluation form afterwards. And our last slide, Caroline, I think, has got our contact details on. So follow us on social media if you want to see how well we do dementia care. Reach out to us on email. That's my email address there, or Caroline's email address. We will share the slides and the recording of this webinar with you afterwards. But other than that, thank you very much for attending today. It's goodbye from me, and goodbye from
Bye-bye.
Caroline.
I need to answer the questions so people can
We
email.
will answer any other questions that we haven't covered on email directly with you. Thank you very much for attending. We will say goodbye to you. Take care. Bye-bye.